And for more on this discussion about Zika virus, we are joined here in the Beijing studio by Dr. George Gao, who is the Deputy Director General of the China Center for Disease Control and Prevention. Welcome, sir. Also in our Beijing studio, we're having Dr. Bernhard Schwartlander, the WHO's representative to China. Welcome as well. Meanwhile, joining us from Washington, D.C., we're having Dr. Alexandra Phelan, who is the Adjunct Professor of Public Health Law and Ethics at Georgetown University, who's also a doctoral researcher at the O'Neill Institute for National and Global Health Law. Welcome to the three of you. First of all, very crucial question. Is the WHO declaring prematurely that this is going to be a global health emergency? Dr. Schwartlander, of course I would go with you first.
No, I think it is very important that we keep a couple of things in mind. One, we have seen a spread of a virus which in itself actually doesn't cause a very severe disease, which is very different from a situation like Ebola. But the evidence is very clear that if the infection happens in a woman that is actually pregnant, we see a strong risk that the child actually develops very severe health complications, like the microcephaly that we have heard in the short video here, and these, of course, are very, very severe health complications. Now, the second thing that we see is that the virus can very easily spread throughout mosquito populations, which are actually everywhere in the world. We have seen how the virus can spread in the Americas very quickly. So the two conditions, the potential for very severe health complications for pregnant women and the fact that the virus can spread easily throughout existing mosquito populations made the decision very important that this is declared a global health emergency.
If it is a global health emergency, Dr. Phelan from the United States, of course, U.S. is in the North America, this is happening in the Americas. So what do you think are some of the important measures to be taken? Or actually, we are too over-alarmed by this health emergency, so-called?
I think the level of alarm is appropriate. I think the declaration of a public health emergency over these clusters of microcephaly is absolutely warranted. In terms of the sorts of measures that need to be taken, it is very much focused, and the temporary recommendations from the Director General have very much been focused on vector control, and that is critical because of the spread of the mosquito that can carry the Zika virus, which is thought to have been to be associated with microcephaly. It's also vital that materials are given to pregnant women or women who are hoping to become pregnant, such as such as insecticides, but also women of possible pregnancy age give access to birth control and contraception is also vital. So the WHO temporary recommendations did touch on them. However, it would have been good to have a little bit more express statements on the sorts of actions that governments should be taking, such as Colombia is doing in distributing condoms.
Dr. Gao, the reason why this is such a complicated issue is because it's dealing with a lot of sensitive ones, socially sensitive ones. For example, reproductive health issue, and how reproductive health devices are going to be delivered to those who might be vulnerable to the virus. We see China, of course, is a very different story because China has been working on reproductive health issue for decades with the birth control. But for the Americas, it's a very different story. And in the Americas, there are developing countries and developed economies, various religions. So once again, the complication over there.
I like what Dr. Schwartlander said, because this is I call this a kind of hidden problem or hidden virus. It's totally different from Ebola or influenza, because the virus itself, first they cause some asymptomatic disease, and then eventually you might get some neonatal malformation and micro and that's really a hidden virus. So this is why it's so difficult. And also, you are right. Think about even in America, you have South and North. One is developed, the other is developing.
Yes, indeed.
So the situation for the vector, the mosquitoes control, and those countries is totally different. And For example, even in China, all those mosquitoes, and we can see it's in China, especially the Aedes aegypti, it's in China. So theoretically, even when it's get into China, it could be a problem. Somehow, I think the WHO's declaration is appropriate because it's a high time, because it's a hidden problem. So whatsoever the WHO declared, it's still advice. Remember, it's advice. It's not a law, it's not a regulation. So people should take this advice.
Dr. Schwartlander, even though you are based in China, but I'm sure as the WHO official, you are looking also at the global impact of this. We mentioned earlier, the reason it's very difficult, it's complicated, it has a lot to do with the socially challenging issues such as reproductive health, such as whether governments will have the legal ground to ask couples to postpone their pregnancy, such as whether the social problems, for example, rapes and unmarried sex and many others, are likely to be dealt with within this framework of public health emergency, which has not been dealt with for decades and in the region. So, Dr. Schwartlander, shed some light on this. Is an emergency declaration likely to change all of the pictures?
I mean, an emergency declaration, of course, is important because it highlights the problems, the issues that we deal with, and it highlights that some of these issues have to be dealt with in the international community. It's not an isolated problem of a given country. No. It's not an isolated problem of a given society. It cuts across in terms of controlling the virus, in terms of controlling the mosquitoes, but also in terms of research, in terms of knowledge, in terms of exchange, and making sure that we are better equipped to actually deal with the consequences, to combat the virus, but also deal with the consequences.
What do you think, Dr. Phelan, of the so-called socially sensitive issue, particularly in some of the American countries? Will an emergency declared by WHO be able to change some of these social debates on the ground, and at least for now?
Well, these are debates that really are, in the public health world, not necessarily debates. Public health and clinical health is quite clear that women should have access to reproductive rights. And so when you then put it in a political or ideological region that currently is dealing with those issues as a social issue, hopefully the WHO, by taking a normative stance, by demonstrating that these are really public health matters, not political or ideological matters, that perhaps that could have a normative influence on the region. And there are incredible activists on the ground, particularly say in Brazil at the moment, who are working to show that this is about public health. This is not about religion or ideology. And at the same time, it's also vital that women who want to get pregnant have the right protection, such as insecticides and controls from their government, so they can have safe pregnancies in the region. So hopefully public health actually is the persuasive normative argument here. And while not legally binding, the temporary recommendations from the WHO are very persuasive.
Right. We hope this could be the silver lining, at least, of this emergency. Dr. Gao, having said that, though, Brazil, for example, is the country likely to host the Olympic Games in just a few months. China, Beijing, was back in the year 2008 the host of Beijing Olympic Games. We all remember how hectic the preparation was, and also how sensitive people are to any kinds of possible emergency in the country. So putting our feet into the shoes of Brazil, for example, now, Dr. Gao, what do you make of the country's measures so far? Have they been really effective, responsible also for the international community?
So as I said, earlier, because this is really a virus, it's a hidden enemy.
Yes, indeed.
At the moment, I think the whole evaluation would be, they have taken the proper measures so far. So I should say so far so good. But the problem is because like 80% of the affected patients, they didn't show any symptoms whatsoever. So I think now when they retrospectively and the Brazilians, they moved back, they found could be there's problem for some of their kind of neonatal malformation, all this kind of stuff, and they already warned, they alert the whole world. I think it's appropriate.
Of course, this requires, Dr. Schwartlander, enormous amount of resources just to systematically check about the possibility of anyone having this virus yet without a symptom. That it takes a lot of efforts. Having said that, though, we have already seen a vaccine being developed, but it would not be available until the very end of the year. Of course, after that, at that point, the Olympic Games have already come to an end. So, given the speed of scientific development in this regard, and the emergency that we already seen spreading out in front of us, what is the thing that we can do, really?
Well, there's a couple of things that we can do. First of all, it is absolutely clear that a vaccine won't happen tomorrow. We would be very lucky, very happy if we had one by the end of the year that can be given to large parts of the population, but it may even be more likely that maybe even longer.
But viruses also changes, so it adds to the complication of developing the vaccine as well.
Yes, but there's a number of things that we know what we can do about. One, we know how to control mosquito populations. And there's many things that can be done, and we have to do more effectively. And we have to work together to make sure that we push back the mosquitoes itself. The second, of course, is, and it has been mentioned already, it's very important that we make sure that everybody who may be living or exposed to the mosquitoes has the knowledge and has the means to protect themselves. And there's very simple matters which are very, very effective. I mean, just wear long sleeves, for example, so mosquitoes don't get to the skin. Have access to effective repellents that actually keep the mosquitoes away, and with the mosquitoes also the virus. So these are the things that we have to focus on now, and we can do a lot, especially also in places like China, where we have seen regular outbreaks with dengue virus, which is transmitted to the same mosquitoes, and make sure that we push back the mosquitoes, and we have the population with the knowledge and the means to protect themselves.
Dr. Gao, we are facing with an ever-changing world, and this world now is pretty much identified by globalization. People just travel so frequently. So is the virus, and therefore international outbreak of disease could be enormous when it comes to the real impact. Dr. Gao, is China prepared for any emergency for example, on this specific issue to spread further than just the Americas?
I think the answer is yes. Since we learned a lot from the SARS outbreak in 2003. So in China, we built up very effective public health system in China at the moment. It's a very good example. I can give you a very good example, and Dr. Schwartlander mentioned about dengue. Obviously this Zika virus is transmitted by the same vectors as mosquitoes as dengue. So last year, we did a great job trying to eradicate and control the vector of the mosquito in that Canton area, and we got a very good, effective result. So last year we didn't have many dengue cases. Really, that really works. So from that sense, and China now, we already called for the national alert for this kind of infectious disease and public health emergency. And we also, I think the commission already had a meeting to have all this coordination system to start to work. So I think China is ready and for preparation and for having any proper probable importation. Yeah.
I see. Dr. Phelan, what about the United States? Of course, it's very much a developed economy. You have much developed systems to prevent diseases, but still, it is in America that we're seeing things are getting worse at this moment. So is the United States ready to guard itself against this disease as well?
Well, the CDC has been very proactive looking at disease vectors like mosquitoes, particularly in light of this possible association with Zika virus. However, one of the concerns is that the regions in which the Aedes genus of mosquito is present in the United States is within southern states and around the Gulf of Mexico states, and that's the most likely area where we will see cases if they are going to occur directly from mosquitoes in the region. Unfortunately, a number of those regions have rural areas or urban areas that are quite poor, that may not have air conditioning, appropriate screening or clearing of stagnant water. And these are the sorts of things that are worrying us in Central and South America about vector control. And so whilst there have been incredibly good vector management processes for